Today I've got 346 results to report to you, of which there is one positive in a returning traveller. That means all of the other results of those 346 are negative. In those results are 207 samples that were taken from children, teachers, staff, parents, bus wardens, a lot of different people at Red Bay Primary School, and all of those were negative. I'd like to send my huge thanks to the staff and Ministry of Health, who really organised everything exceptionally well at the school, and then to Public Health itself. They were swabbing at the same time as they sent out this emergency crew to the school. They had a team already at the airport meeting the flight from Miami, and another team going to the needs assessment unit to swab and sample them as well. So a huge mobilization of people and resources. Just to give you a little bit more information of what I know about the positive result in the child from Red Bay Primary. As I mentioned yesterday, it was a very weak result. We have taken a subsequent sample from the same person, and that result was negative. The father has been negative, the mother has been negative, the sibling of this person has been negative. So all in all, it was a very weak result. We needed to pay attention to it because the child was symptomatic, as is the child's sibling, and father has been as well. It's great news that this child was in a school where they are managing bubbles. So the year 2 was in a bubble. So we are going to be recommending to the Ministry of Health and asking them to assist us in excluding that bubble of year 2 from school for 14 days after the last contact with this person who had returned the weak positive result. In line with World Health Organization recommendations for quarantining of contacts of a COVID positive case, they will need to be isolated for a period of 2 weeks, that's 14 days. For anybody in contact with the child in question, that day was Friday the 2nd of October, and so their isolation period would end on the 16th of October, with testing afterwards being on the 17th of October, which is a Saturday. Clearly the Saturday may cause some difficulties, so we will make arrangements in due course. All in all, I think that we should be hugely reassured by what we've had so far, and I am very relieved today, a totally different person in terms of emotions than I was 24 hours a day, so I am hugely reassured. It's unlikely that this child has been infectious because of the level of virus is very low, but we are being cautious with the results that we've received, and therefore we are asking for all contacts, close contacts, to be isolated. Public Health will continue to do contact tracing around any relationships, of course, with other members of the family, with the other sibling, with the mother, with the father, and any relationships beyond that. And just to remind you, a close contact is having spent more than 15 minutes at less than 6 feet from somebody known to have Covid-19 disease. It's very likely that this result reflects some trailing infection or viral remnants of a particle. We have had a case conference meeting, an incident meeting this morning at the Health Services Authority, and I thank everybody that came in very early in the morning in order to get this done, to talk through all of the processes that lead up to producing a result. And I'm confident that the result reflects a true result. All of the possibilities for false positives, there are so many checks and balances that are put in place to make sure that doesn't happen. I don't feel this is the case here. Thank you.